name's Tamika and I'm an exercise physiologist here at True North Wellness.
Hello, and I'm Kay. I'm one of Tamika's patients, and she's been working with me for the last 2 years doing for my treatment for breast cancer.
Perfect. We're going to share a little bit of Kay's story today. So Kay, tell us a little bit about your diagnosis and the type of treatment that you undertook.
Well, I went for a routine mammogram back in 2019, and I was diagnosed with a breast cancer, an early stage breast cancer, a triple positive, but they reassured me that it was an early diagnosis and I'd have a good outcome. So not long after that I went to have surgery and I had a breast lump ectomy and 2 lymph nodes and a sentinel node biopsy, and had 2 lymph nodes taken out of my axilla, and luckily they were clear, and so I had a fairly simple surgery of a breast lumpectomy which took out the whole cancer, but they did suggest I have chemotherapy. I had to have 12 weeks of chemotherapy, and because I had triple positive breast cancer I had to have 12 months of Herceptin infusions because I had a HER2 positive cancer, and also a round of radiation therapy.
Okay, so at what stage of this process did you initially come to work with me, and what were you hoping to get out of it back at the start?
Well, they gave me a lot of information at the breast screen, and also my surgeon talked to me, and by that time I'd talked to the oncologist, the medical oncologist, and they mentioned that, and I had read that exercise physiology was a very good idea for people with breast cancer or any sorts of cancer to help them through their journey. And being a nurse myself, I know that it was important to do something positive for yourself, and I've always liked to be fit. I'm a bushwalker. I've always liked to do lots of exercise, so I wanted to make sure that I was strong enough to get through the chemotherapy, because I was a little bit worried about that. And so my oncologist had said, try and find yourself an exercise physiologist. So I just looked up a local exercise physiologist and found Tamika, and that was the start of a good relationship. So I'm really happy I found Tamika, and I started doing the exercises because she also made sure that she kept me on track when I was feeling down through the work that we were doing together. She didn't push me, but she was firm, and she told me how important it was for my bone strength, because since then I've had to have estrogen or anti-estrogen treatment through tablets that I have to take for the next 5 to 10 years, and that doesn't do well with your bone strength, and I was already osteopenic, so I thought I better do something positive about that. So the bone strengthening exercises and the weight bearing exercise is really important, and I feel a lot better for it. Also, you have some side effects from having the bone the anti-estrogen therapy, and that some of it is muscle pain, and I feel the exercise really helps that. And the other thing about exercise physiology is really when you're in care of oncologists, and everything just comes at you and you just have to accept it, and I think doing something positive for yourself is really important, because I felt like I was doing something very positive to help myself get through the treatment, and my oncologist encouraged me. He always said every time he saw me, what sort of exercises are you doing, and he was always saying, great job, fantastic, keep it up. So that was really encouraging for me, and I wanted to do that.
Awesome, Kay. So what advice would you give someone in a similar situation that you were back then?
Well, I've already given the advice. I give it to a lot of people. I've met quite a few women with breast cancer since I've started my treatment, and I've told them all that I thought that the exercise physiology was really important for doing something for yourself, and making sure you didn't lose your fitness and go backwards from where you are, because I did meet some ladies in the hospital who said, oh, I'm just going to sit back and eat what I like and rest, and and I already thought that was not a good idea. So I've tried to encourage people who have had they've asked my help, and I've said that I think find yourself an exercise physiologist. And I know of a couple of ladies who have done that, and I'm really also very grateful that they have done that from the beginning. So it's hard to go through something like that and then all of a sudden say in 2 years, oh, I'll just pick up, because 2 years older, especially when you're in your 60s and my age, stopping exercise for 2 years because you're having chemo is just not an option. You would have such a hard time picking up from there. So I'm glad I'm actually fitter now than I was when I started.
That's awesome. Thanks so much for sharing your story, Kay.
Oh, that's okay, Tamika. Thank you.
Thank you.